35th week of pregnancy, 8th month of pregnancy. Let's make a deal. Any news on your baby? So some difficulties that you may be going through, and I will help you. Food tip and a special tip for this week. You know what? Stay with me and I'll cash it out. Hello, I'm Monica Romero. I'm very happy to have you here with me. 8th month, end of the 8th month of gestation. Tell me, do you have the impression that it passed quickly? Do you have the impression that it passed slowly, or are you like me? There are times when you think it passed quickly. There are times when you think it passed slowly. There are times when you think there is a lot left. There are times when I think there is little left. Tell me that I really want to know and enjoy it. Let me enjoy it here in the video. Now at the beginning, it already helps me a lot. Let's talk about your body. Look how your uterus is completely taken over by your baby who is in the fetal position because he can no longer move that much. Your uterus can be felt about 6 inches above your belly button. But if your baby is upside down, a position we call the delivery position and already fitting into the pelvis. Maybe you feel your belly dropping about 4 fingers down there from your chest. It seems to make a hole, helps us breathe better, helps our digestion, decreases heartburn and reflux, but sour to the bathroom. These get more intense. If it was already difficult to sleep before, imagine now with this temporary urinary incontinence due to your bladder. Are you overstressed by uterine growth? She lost the ability to accumulate a lot, and we always have that feeling of wanting to pee. What if by chance it's escaping pee and you're in doubt whether it's urine or amniotic fluid? Please pay close attention. You can see that the amniotic fluid, it smells a little bit more like bleach, not the same, but it reminds you a little bit more. It smells very different from the smell of urine. If in doubt, seek a doctor or a hospital with obstetric care, or even go to the maternity hospital so that you have no doubts whether it is really the amniotic fluid or not. Okay, we can't play anymore, especially at this point in the championship when there is already so little left. And if you're a mom of twins or triplets, quadruplets or quintuplets, your final stretch has already arrived. Most bodies happen between 34 and 37. So at 34, it's already gone. It's already here in the 35th week. So for you, everything has to be super organized, and the discomforts that I report now here for you to be more intense. Now, at the end of pregnancy, there is a lot of blood that is being directed there to your uterus, to your placenta, which gives the feeling that our heart is beating in our belly. It doesn't look like your heart is there in your belly, and sometimes you lie on your stomach. You can even see the pulse happening, and with all this anxiety, along with all the hormones, what a peak so high, right? You may have more mood swings. And in these mood swings, you may notice, for example, that you are very anxious, very nervous with palpitations. Problems seem like they are too difficult to solve every time you catch yourself very tense, nervous, anxious, with your heart racing, with that anguish in your chest. For a little, stretch your body, stretch your arms up, forward, stretch your spine a little. It goes sideways, reconnects with your breath. Pay attention to her, the time you inhale, the time you exhale. Pay attention until you can relax again, or relax. Am I exaggerating? Sometimes it's not possible, but at least you can. Think a little bit again. If you need to, take more than an hour to return to that subject, because sometimes the solution is easier than we imagine, but it is in the middle of the eye of the hurricane. They don't let us see the solutions. They seem to be much harder than they really are. So she's very nervous. She's very anxious for everything. For herself, you need some time. Pregnancy is not a disease, but you are in the final stretch. Your body is super dedicated from pregnancy. You're tired, you're in pain. It is not an easy time, and if you charge too much or want to solve things from 1 hour to the next, will not be easy for you. So also allow yourself to move away a little from the problems to try to see for another optic, and suddenly the solution will be much easier or better. difficult for you to get there in your goal. Due to uterine enlargement, we also begin to feel more pain in our ribs. They will be more crushed, more pressured because of the baby. And sometimes he moves. Looks like he puts his foot right on his rib hand, doesn't he, guys? Even a little nudge. Oh, stop it, child. Oh. What will improve a little bit for you is to try to breathe slowly and massage. This area can bring a little more comfort. It is during this week that you will need to perform the test of the cotton swab that you will see in your vaginal canal. If you have a group B strep bacteria, this bacteria, if in a normal delivery, it can come into contact with the baby and cause some problems with respiratory problems, for example, when performing this exam, will appear if it is positive. If it is positive, you will be medicated, you will take the medicine, you will see if it kills this bacteria, and you will repeat the test. It was negative. Keep the exam in the briefcase in the maternity suitcase. At the time of hospitalization, it will be mandatory to present it. If you do not submit, it will be held again. Yes, he's uncomfortable, he's mean, he's boring, but he's more than necessary. So we go there, prepare ourselves, and go into a gynecological position. A cotton swab will be placed there in your vaginal canal to do this collection and see if you have group B streptococci, other tests as well, which if you haven't done yet, we'll perform for now. I amended everything. I did everything together. I had to go to the laboratory to do the collection. I already did the blood test too. It is a complete blood count, which will repeat several tests that you did at the beginning of the pregnancy, and I will repeat them now to see how you will be at the time of delivery. The result of this test also needs to be taken to the maternity hospital, and in this blood count will be evaluated simple rubella, HIV, is toxoplasmosis, hepatitis, ABEC, TSH-T3T4 free. I quote megalovirus, our blood sugar. There are several. It is a very complete blood count, and along with them too. A urine test may be requested to see if you have any urinary infection. It is important to carry out all these tests, save the result. If by chance you have some little problem there, the doctor will already enter with the treatment and will be the best, including to evaluate how it will be your birth. And if you have already done the ultrasound, usually does a 34, but if you are doing it for now, we'll also evaluate the ultrasound data to see what will be the best birth for you, a healthy woman. Receive your healthy baby in your ass and last me. Count in the comments. Are you afraid of childbirth? Are you unsure? What are you thinking? What are the main doubts you have? Because what causes the most fear in childbirth are the doubts and the stories we hear out there. Yes, there are only drunken stories, tragic, difficult as in any story. But we forget to realize that more than 99% of stories are happy. The experience of childbirth, it may have been painful, it was different than you planned. I, for example, wanted a normal humanized birth. I had a humanized cesarean section. It was different from what I dreamed, but they were things of the circumstances I had to do. I had no dilation, Lucas with ventral pain. It was a series of things. I have here the report of my birth if you want to take a look. I have me crying, including, but you can take a look here at this link. Why? Because when we don't have a lot of information, we have a lot of insecurity. We don't know what's going to happen. So what am I going to indicate to you? First, I'm going to indicate this video that I'm talking about childbirth. Second, I'm going to point you to this other video where I talk about birth plan. In the birth plan, you can explore all your possibilities. It is not a contract that you will make with your doctor, but it is a document that you can ask him about all the doubts you have. In my case, that the baby is like this. What can I do? Motherhood, what is it like? How am I going to do it? And this birth plan, you can print copies and deliver to the maternity hospital or the hospital where you are going to have your child. And it will help you not only understand what you plan, what you would like, but also help the dwarf professionals not be asking you at a time when you are extremely focused on your birth. I made this document myself. It is this document that is here on your side. It is OPDF. I'll leave it here for you to download. And the greatest importance of it for me is to open the dialogue and understand what the possibilities are for childbirth. That's it. This AI story is breaking the bank. It's being born. It can't break the bank and be born. Hours later, I had a contraction. It's not being born. from the first contraction to the arrival of active labor will take some time. You have to know if you live far or near a hospital to know when you should go. So if you live far away, given a 10-minute interval between each contraction, you already go to a maternity hospital, live nearby, you can expect a 6-minute interval between each contraction. It is very rare for a woman to give birth so easily. This will end up in the news because it is too rare. It's not common for that to happen, okay? Remember that normal birth, yes, is the best for the baby. It is the best for the mother, but it will not always be possible. And a cesarean section can save your baby's life or yours. So you have to demonize cesarean section or demonize childbirth because of the pain of someone who is natural. You have to understand their possibilities and see what best fits within their dreams, their expectations, ESIM. A normal birth without pain is also possible. Okay, it can give you analgesia so you won't feel pain, but you will know when you have the contraction so you can exert force. So there are so many possibilities, and I will leave this video linked for you to inform yourself. And my favorite time has arrived. We talked about childbirth. Now let's talk about why you saw childbirth so you can see if the baby is beautiful. Who is now in the 35th week already measuring around 34 centimeters from head to butt? Considering the legs, we are talking about 45 centimeters approximately, and weighing about 2 kilos and 600, it's 600 grams in 2 weeks. The difference in his weight can be felt in his belly and in his back also, that it hurts in his back. The baby's skin is smoother, that of the face, that of the arms and everything, because of this adipose tissue, this brown fat. That is the name of this little fat that he is receiving, and that will help control the temperature at the time he leaves our belly. By the way, if he had a premature birth, today, yes, it is still premature. He stops being premature in 2 weeks. He's 37 weeks. The baby is considered 100% ready to be born for now. The biggest difficulty he may have is in temperature control and suction. When breastfeeding, he may have difficulty grasping his mother's breast, and we can feed him either with a spoon or a cup, and the mother can milk this milk, right, to be able to offer it to the baby and continue stimulating to continue milk production. Speaking of suction, today in an ultrasound, you can already observe your baby training there. The sucking movements, because they are already more improved, they are already getting a lot. There are 2 weeks left to be born, right? So you can see there is very little left for him to be ready to suck at the time of breastfeeding. The uterus is already very tight for him, so he can no longer turn as much, except if he is sitting down. He can still move. It will be difficult, but he can do it to be able to come to the delivery position, to the cephalic position upside down. He can still do this movement, except if he's already upside down, his little head went down a little bit into his pelvis, like it got stuck a little bit. So he'll only be able to spin, but he can't turn anymore because of the size of the baby and the uterus. The skin is right there, right? It's the uterus. It's less thick, it's thinner. Some women can recognize a little hand or a little foot when the baby pushes on the belly. Speaking of movements, although it is difficult for your baby to move much, he still moves his arm, elbow, legs. He still has moves. What does that mean? If you go more than 3 hours without feeling any movement from your baby, it is important that you put on a sound for him to hear, or that you eat a candy to get him excited. See if he still doesn't move. If he continues, you have to seek medical help, okay? You have to go to the hospital for obstetric care or to a maternity ward, see if everything is okay with your baby. And your baby already recognizes your voice and the voice of everyone you live with. So take the opportunity to continue talking, reading history, singing. And speaking of music, after he comes over here, if you sing a song that you like, right, often during pregnancy, or if you listen to a song a lot, when you bring him over here and he listens to the same song, the same rhythm, he calms down. This research has already been carried out and proven, and you can prove it in your home soon. And my food tip will be, very quickly, I'm going to tell you 2 different things. Your baby's first brain development is super accelerated, and omega-3s help with this development. You find omega-3 in addition to those foods that are passing to you in fish like salmon, tuna, and it could be the cans, yes. And the second tip, we go to constipation. Uterus has grown so much that your intestine is pressed. It becomes more difficult to perform peristaltic movements. And what do we do to improve constipation, right? Get rid of this trapped gut. The first thing is to hydrate. You have to drink plenty of water, okay? This is very important. And the second, to eat the most fiber. These are foods that will increase the amount of stool and help your intestine push down there. You find it in these foods that are showing here on the screen for you, but mainly, right? The easiest way are whole grain flours. Instead of having that white flour or the one that is enriched, it's whole grains, whole rice, whole wheat. All of this will help you make your intestines work better. And in my tip of the week, there are 2 tips. The first is that you do not need to prepare your breast for breastfeeding. You may have noticed that around the spout there, you might have some little balls around it. They're called Montgomery glands. These glands are sebaceous glands that will help hydrate this region. So we don't apply moisturizer to the nipple. It's on the areola. It doesn't apply to this region. That is, these Montgomery glands, don't squeeze, don't move, leave it there. Quiet, Tina, it will work well. And the most important thing is that what hurts the nipple, right? That can bleed, crack. It's not breastfeeding itself, but the wrong grip of the baby. I'll leave you here this image that shows you a little bit of the grip, but I'll show you what happens. The little bit of the baby is tiny. Oh, you can see she's not opening much. When we pass the nipple, I'll leave it here on the side, which will be easier. When the nipple passes, the baby will open his mouth instinctively, and we will make a C to decrease here. Oh, this depth, we will fit from top to bottom, bringing the nipple here, oh, to the baby's soft palate, to the back of the mouth. The nipple is not a straw. It is not by pulling the nipple that comes out. It is by stimulating the areola. When he is stimulating this region, the law. Milk comes out. This also works for those who have an inverted nipple here, an inverted nipple, you know. It's inside there. As it makes the milk come out, it's stimulation from here. The nipple doesn't need to be outside. But it's a little more difficult for us to adjust the baby's grip because we have to make a deeper grip. And one of the mistakes we make the most, we put the breast on, right? Our breasts are facing each other. We made our breasts here facing each other, right? Only the baby's on his side. Didn't fit, did it? You're here and the baby's mouth is here. We have to do OC always in the position of the baby's mouth so that he can bite as much as he can when you go into labor. Milk hasn't gone down yet, which we call leaning. You still have colostrum that is low in quantity because the baby's gastric capacity is still very small. To give you an idea, this is the gastric capacity of your baby when he is born, equivalent to a cherry. 3 days later, it has increased. A week later, there is already a stomach there of respect. This is where milk comes down. Breast milk, what we know, it comes down here around 24 hours, more or less after delivery. A normal birth ends up coming down earlier, and a cesarean delivery may take a little longer, but no problem. There will be no shortage of milk during this period. There will only be a smaller amount. This is your baby's stomach at 1 week, and this is your baby's stomach after 1 month of breastfeeding. So don't worry about the amount of colostrum now. If it hasn't come out of your chest, it's okay. My second point is about maternity leave. Have you programmed yours yet? Not all babies are born at 40 weeks. They may be born a little earlier or even a little later, but their maternity leave may start sooner. You can ask for a certificate from your doctor. If you're having difficulty with pain so that your maternity leave begins a few days to a few weeks earlier, and this can help you plan, relax, and focus more for the birth. Talk to your doctor about this and don't commit to doing anything other than taking care of your baby during maternity leave. I made a mistake. I thought that maternity leave would give me time to take care of the baby and do something else, but it doesn't. When the baby is born, our dedication is 100% to him. We can't take care of other things. Carrying out other jobs is extremely exhausting for those who need to do this, so don't commit yourself. Maternity leave is not a vacation. You will not rest. You will be working 24 hours a day because your baby wakes up from a few hours to breastfeed. And this dedication is maternity leave exactly for this dedication, so that you are there for what matters most in your life, which is your child. And at this moment, it cannot be work. So do not commit to doing some things during your leave, because this will harm you, and tired mother can harm milk production. We don't want that, do we? I hope you enjoyed these tips. If you did, don't forget to let me like it for me. See you in the next video.